Hello everyone. In this session, we are going to discuss an ultra important topic that is diabetes mellitus. Now, in your university exam, very frequently you get question on diabetes. Most commonly, you get the question on diabetes is long question. So, especially they ask you about the classification, pathogenesis, risk factors, clinical features, complications, and diagnosis. So, here we are going to discuss everything about the diabetes. And sometimes you can get a short or very short question only on one portion of that. So, let's start the topic diabetes. Diabetes mellitus. So let's start it. So first of all, I would like to give you an overview, the headings under which we are going to describe this topic. So in your university exam, you have to write your answer in headings. You don't have to write the paragraphs. You have to write your answer under headings and subheadings. So I request all your students to learn the overview, to have a look in the overview and write your answer, frame your answer under these headings only if it is coming as a long question. If it is a short question, only one portion of that is asked. So you have to write down that portion only. But if it is a long question, you have to frame it beautifully under these headings. So in diabetes mellitus, before understanding the topic diabetes, you must understand the pancreas. You can't understand diabetes if you don't understand the anatomy and histology of pancreas. So first we will discuss the normal histology of the pancreas, then we will start the topic diabetes. Now the diabetes I will describe under following headings. First of all, I will let you know the introduction. What is diabetes? Then we will see the classification of the diabetes. Then we will see the risk factors. And then we will see the insulin regulation, its synthesis, its release, and its action. Then we will come on the pathogenesis of type 1 as well as type 2 diabetes. Then clinical features, the differences between type 1, type 2, complications, and finally the diagnosis of diabetes. So if it is a long question, you have to write down everything by managing time. It's a big topic. So you have to manage the time and write down everything about that. But if it is a short question, rather the question will be either on classification, or more commonly on the pathogenesis or clinical features or complication or diagnosis. So you have to write down that portion only depending on the weightage of the marks. Is it a short question or long question? So let's start the topic diabetes. So as I told you, before understanding the topic diabetes, you must understand the normal histology of the pancreas. So can you see this is a human body? In the human body, can you see the pancreas is a abdominal organ? Yes. So pancreas is the abdominal organ in human body. So although anatomically you can see the pancreas is a single organ, you can see this is a single organ, but histologically and functionally it's a dual organ, it's a double organ. So you can see the histology of the pancreas. So this is the histology of the pancreas. Inside the pancreas, there are two portions. What are the two portions in the pancreas? So there is exocrine portion and there is endocrine portion. The exocrine portion is in the form of the acini. Can you see? These are pancreatic acini and they secrete enzymes which are important for digestion. That is the exocrine portion. And the endocrine portion is in the form of islet of Langerhans. What is islet of Langerhans? You can see this is islet of Langerhans. It is a collection of multiple cells. That is islet of Langerhans and it secretes hormone. Currently, for understanding diabetes, we have to concentrate on the endocrine part of the pancreas. That is, I am interested in the islet of Langerhans and it is secreting the hormones. So first understand normal histology, histology of the pancreas. Pancreas, although anatomically a single organ, but histologically it's a dual organ. It is having exocrine part, it is having endocrine part. The exocrine part is in the form of the acini and the endocrine part, acini are the glands. You know, I have shown you the circular glands now, and endocrine part is in the form of the islet of Langerhans. So this is a collection of cells, and exocrine part secrete enzymes which are required for digestion. Endocrine part secrete hormones. Currently for diabetes, we are interested in this portion. So I want to highlight the endocrine portion of the pancreas. So I want to highlight what is islet of Langerhans. As I told you, the islet of Langerhans, can you see? The islet of Langerhans, it's a collection of cells. So there are four major cells inside islet of Langerhans. What are the four major cells? So the four major cells are alpha cell, beta cell, delta cell, and pancreatic polypeptide PP cell. Alpha cells secrete glucagon in the blood. Beta cells secrete insulin in the blood. Delta cells secrete somatostatin in the blood. And pancreatic polypeptide secrete pancreatic polypeptide PP in the blood. So please understand alpha, beta, delta and PP cell. Please learn the four type of the cells. So in an islet of Langerhans, there are four type of cell. There are alpha cells which secrete glucagon. There are beta cell which secrete insulin. There are delta cell, and there is pancreatic polypeptide cell. So you have to learn the four type of cell: alpha, beta, delta.